Does Doctors Hospital have a quality program or product that it can offer? Yes. Does Doctors Hospital in a position to facilitate or assist the process for companies or corporations or groups that are interested in coming in? The answer would be yes. We certainly can direct them to the appropriate resources when we don't have them. And thirdly, is Doctors Hospital have a legacy or history of doing this and establishing really good, productive, mutually beneficial relationships? The answer is yes. So for almost a decade now, Doctors Hospital has taken a serious look at quality, safety, and standards. And this speaks to our commitment to our process of Joint Commission International Accreditation. We have the distinguished advantage of being the first hospital of our type in the Caribbean, certainly in the English-speaking Caribbean, to be accredited by the Joint Commission International. And with that comes that good housekeeping seal of approval with respect to our standards. We regard the safety of our healthcare environment to be of utmost importance, and the whole issue of standards speaks a lot to the processes and the methods that we adhere to. This program, we were able to treat about 800 patients, most of these patients coming from the US. And the model that we used with that trial was to engage the patients, confirm that they meet the criteria, and then match the patients with their urologist, who would come into the Bahamas, into Doctors Hospital, into the operating room with their patients, and see themselves the procedure and subsequently follow up with these patients. So that is a program that perhaps has taught us then one step further, where we may not necessarily have to bring in, even though we're not averse to doing that, we don't have to bring in providers from external territories. We can do a lot in terms of working the patients up prior to them coming, and once they come, they are subjected to a fairly packaged and standardized protocol, and once they're through with that, we also confirm their follow-up with their physicians back home. And like I said, qualitatively, we get significant data, and the quantitative measures are also in play. Interesting and ideal, the Bahamas has an enabling legislation, and the stem cell legislation means that there is a National Stem Cell Ethics Committee which provides a forum for the review, perusal, consideration, and approval of any serious research effort. So this particular program is using autologous bone marrow, your own bone marrow, and reinfusing that into your circulation. This is a very interesting and new program, and its aim is to provide much better control of diabetes. With those three programs, we feel that we have tried and tested the formula of the relationships with programs brought from abroad. We know the steps involved in getting the regulatory approvals for registration and licensure of the providers, the important steps for companies to take so that they can actually navigate through the investment board, the National Economic Council, etc., etc. So we consider ourselves, in summary, to be ideally located, to have an ideal situation with an enabling legislation, and to have a willingness, because of our vision as a health system who is continually looking in the future at opportunities in the future, then we see, for all those reasons, Doctors Hospital becoming your ideal partner.